I'm George Flynn, and you're watching In-Depth TV. Today, I've got something to talk with you about your health that may surprise you quite a bit. It's vitamins, specifically one vitamin, vitamin D. Now, there's a lot of talk about vitamin D and what it does and things like that, and I just want to explain to you so that you understand vitamin D and what it is. Vitamin D is one of the many nutrients our body needs to stay healthy. Some of the vitamin D functions are it helps the body absorb calcium. Vitamin D, along with calcium, helps build bones and keep bones strong and healthy. You don't want to have weak bones or brittle bones. And vitamin D blocks the release of parathyroid hormone, and this hormone reabsorbs or takes away bone tissue, and this makes bones thin and brittle. Vitamin D may also play a role in muscle function and in the immune system. Now, the immune system, I hope you know, is your body's defense system. It helps protect you against infections and other illnesses, and taking vitamin D every day has been shown to reduce the risk of falling in older adults. Well, other ways vitamin D is thought to help us is what is it? How much do we need to take? Well, that's an area of research, and there's some controversy about how much vitamin D you need and what do you need at what age. So we're going to talk about that a little bit, and there's a lot of research going on about vitamin D and what you need and how much of it you need. Well, there's studies going on, and they're under debate, and without other long-term research, even many of the researchers who concluded these initial studies, they're cautious about vitamin D use in the prevention of diseases. Now, the reason for this is vitamin D is what's called a fat-soluble vitamin. There are 4 fat-soluble vitamins. There's one is K, vitamin K, vitamin A, vitamin D, and vitamin E, as in echo. So K, A, D, and E, they're the fat-soluble vitamins. They're the ones that you can get too much of. Now, the other vitamins are water-soluble, like vitamin C. It's water-soluble, and if you take too much, it's excreted through the kidneys. But the fat-soluble, you can get what's called hypervitaminosis, and that's too much of that vitamin. Where do you primarily get vitamin D? Well, sun exposure, your diet, and supplements. You know, vitamin D is produced when your skin is exposed to the sunshine, and the amount of vitamin D your skin makes depends on factors as the season. Usually there's less sunshine in the winter months, and the time of day. You know, the sun's rays are most powerful between 10 a.m. and 3 p.m., and the amount of cloud cover, the air pollution, and where you live, there's just all kind of factors in that. And also, dermatologists suggest not so much exposure to the sun because it causes skin lesions, such as precancer lesions or skin cancers. So we're getting a problem there in exposure to the sun elevates your vitamin D, but exposure to the sun also increases the risk of skin cancer. Well, what other ways can you get it? Food, diet. That's the best way to get enough vitamin D is to eat a variety of healthy foods from all the food groups. The vitamin content of various foods is shown, on the labels, and usually, but the international units, we'll just give you a rough rule of thumb here. Cod liver oil, a tablespoon, has 1,360 vitamin D units. Swordfish, 3 ounces, 566. Tuna, 154. Orange juice, fortified with vitamin D, has 137. Milk, now everybody talks about milk being so high in vitamin D. It's got 115 vitamin D units in 1 cup. So, there we are. Vitamin D it's in a lot of foods, but you've got to be careful because, we've got to watch out what we eat and how much of it. Well, health professionals, dietary supplement fact sheets, they're all out there, and you can find one. And vitamin D can be added to products such as orange juice, yogurt, and margarine, but there are so many other ways to get it, like supplements. Supplements are out there, and you can get vitamin D. Vitamin D's sun exposure may increase the risk of skin cancer, and the wrong foods may, upset your metabolism. How much vitamin D is really needed? In healthy people, the amount of vitamin D needed per day, it's important to know these recommendations, and your dose of vitamin D may be higher or lower according to your doctor, your endocrinologist, your provider, your nurse practitioner, and older patients need a little bit more vitamin D than younger patients. And we want to keep your vitamin D daily recommendation update, the daily dietary increase, to a normal level. Now, infants 0 to 6 months need about 400 units per day. 6 to 12 months, about 400 units a day. And 1 to 3-year-old, about 600 units a day. 4 to 8, about 600 units. From 9 until 70, about 600 units per day. Now, the upper limit of that is 4,000 units. So I suggest you deal with your dietitian, your physician, your nurse practitioner, and come up with the right amount for you. Over 70, it's either 800 units, and the upper level would be 4,000 units. So those are general things from the Institute of Medicine, and that was back in 2010. But there are medical conditions. Now, if you have one of these, you may have a vitamin D shortage. And it can be caused by conditions that are diagnosed by your physician or your nurse practitioner or your healthcare provider. There's an enzyme that can be deficient that converts vitamin D to usable vitamin D. And some diseases, such as gastric bypass surgery, this weight loss surgery can lower the amount of vitamin D that can be absorbed. So we just want to make sure that you are covered. If your body mass index is greater than 30, you have lower vitamin D levels. It is thought that the extra adipose tissue or fat holds on to the vitamin D and does not allow it to be released into the bloodstream. Now, we talked about vitamin D being a fat-soluble vitamin. So if you've got extra fat, vitamin D is stored in that fat and not available to your bloodstream. There are other things that can lead to vitamin D deficiency, such as age. The skin's ability to make vitamin D lessens with age. Mobility, people who are homebound or rarely outside, nursing homes, other facilities, they don't get sun exposure and they don't get vitamin D. If darker color skin is less able to make vitamin D than fair skin. Human breast milk, the woman's breast milk, only contains a small amount of vitamin D, so infant formulas often contain very little vitamin D. Therefore, infants who are breastfed are at risk for not getting enough vitamin D. Medications. There are certain medications that can cause a decrease in vitamin D or a decrease in the absorption of vitamin D, such as prednisone or some of the things that lower cholesterol, TB drugs or tuberculosis drugs, weight loss drugs. They can cause lower than normal vitamin D. Well, what about your vitamin D? Do you get it checked? Do you get it routinely checked? And how often should you get it checked? Well, routine checks are not really currently recommended, but your doctor might need to check your level if you have a medical condition or risk factor for vitamin D deficiency. Sometimes vitamin D levels can be checked, such as if you have long-lasting body aches, muscle aches, all of a sudden you're tired, you wake up from a good night's sleep and you're still exhausted. Those kind of things can, be related to vitamin D deficiency. Osteoporosis, when we've all heard of that, it's associated with decreased bone density and it can increase the level of fractures. Well, can you have too much vitamin D? Well, there's a daily dose. We talked about the daily dose of vitamin D. But what happens if you get too much vitamin D? It can cause nausea, vomiting, itching, increased thirst and urination, or poor appetite. It can cause all kind of things, the same weakness and weight loss. So you've got to watch your vitamin D and make sure that it is correct. And please don't take higher than the recommended dose of vitamin D without first discussing it with your doctor. A lot of people would say, well, if a little vitamin D is good, a lot more is better. Well, remember, this is a fat-soluble vitamin in which you can take too much. Your doctor may recommend higher doses of vitamin D if he or she is checking your blood vessels and adjusting your dose accordingly. So we're going to make sure that vitamin D deficiency, the goal of treatment and the prevention are the same, to reach and maintain an adequate level of vitamin D in your body. And there are a combination of ways you can do it. Get a little bit of sunshine, eat more foods that contain vitamin D, and you can find this. But just remember, not too much sunshine and not too many of the foods. 5 to 15 minutes of sun exposure 3 times a week to the face, arms, and legs or back. That's all you need. That's all you need. Older patients are those with darker skin colors, and those in the northern climates, they need just a little more sun exposure. But remember, the use of sunscreen and standing behind a window prevents vitamin D from being produced in the skin. Well, too much sunshine increases the risk of skin cancer. So we talked about that. We've got to balance those two. A little bit of exposure to get your vitamin D levels up, or you can take a vitamin D supplement and diet. So you've got several ways of having less vitamin D. You've got several ways of improving the amount of vitamin D that you have. And just remember, vitamin D comes in D2 and D3 supplements. These two forms are equally good for bone health. Work with your doctor or healthcare provider and figure out how much vitamin D that you actually need to have optimum health. That's what I want to see for you, so that you can have the correct health, the correct energy, the correct mood, the correct everything, because I want your life to be the best that it can possibly be. I'm George Flynn. You've been watching In-Depth TV. We've been talking about vitamin D, and I urge you, if you've got any questions, talk with your healthcare provider about the vitamin D levels in your body. Thank you for watching.